I think to mitigate the impact of natural disasters on healthcare providers and patients in the future, several changes need to be made both at the macro and micro level. For example, at the macro level, changes including strengthening healthcare infrastructure. I think we need to improve structural resilience of healthcare facilities to withstand disasters. We need to develop redundant power systems, including microgrids and renewable energy resources and sources, and enhance water and sanitation systems to maintain functionality during these disasters. I think it's important for us to consider diversifying and strengthening supply chains like we're seeing right now. We need to establish multiple manufacturing sites for critical medical supplies. We need to create stockpiles of essential medications and equipment. We need to develop flexible distribution networks to adapt to disaster scenarios. I think we need to improve disaster preparedness and response planning. We need to develop comprehensive, coordinated disaster response plans at a national and regional level. We need to conduct regular drills and simulations to test and refine these plans. We need to establish clear communication channels between healthcare facilities, emergency services, and government agencies. I think it's important for us to consider these 100-year storms are happening 2 or 3 times a year now. We need to address health disparities. We need to invest in improving healthcare access and quality in vulnerable communities. We need to develop targeted disaster preparedness strategies for at-risk populations. We need to incorporate health equity considerations into disaster response planning. We need to enhance our healthcare workforce capacity. We need to increase training in disaster medicine and emergency response for healthcare professionals. On the micro level, we need facility level preparedness and develop and regularly update facility-specific disaster response plans. We need staff and training support, which will provide regular disaster response training for all staff members. We need patient-centered care adaptations, which would create systems for maintaining access to patient medical records during disasters. We need community engagement, which would foster partnerships with local community organizations for disaster planning. We need technological integration, which would implement robust electronic health systems with offline capacities. And we need resource management, which would implement efficient inventory management systems for medical supplies and medications. In the end, by implementing all of these changes at both the macro and the micro levels, healthcare systems can become more resilient to natural disasters, ultimately improving outcomes for both healthcare providers and patients. And I think this approach requires ongoing commitment, investment, and collaboration among healthcare organizations, government, agencies, and communities.